Dr. Rankin, you work in palliative care, right? So could you tell the viewers a little bit about what that means?
Yeah, so palliative medicine is a type of medicine where an interdisciplinary group of people, like doctors, nurses, chaplains, and social workers, add an extra layer of support to somebody facing serious illness, basically. And that can happen in the hospital. So if somebody gets sicker than they were before and decisions need to be made, or are just finding out that they're really sick, we can come in and help, to palliate means to ease symptoms or to ease suffering. And so palliative care is to ease suffering. And so we come in and support patients, but also their loved ones. So we talk a lot about who is the human being in the bed and what makes them them. And then we work really hard to help align their medical care with who they are. And that is done a lot of times with their families, speaking for them or about them because they're too sick. So that's inpatient. Outpatient is the same thing, but usually just sort of a longer time course. As somebody has an illness, we support them through it.
So I think a lot of times when people think of palliative care, they think of maybe chronic disease like end-stage kidney disease or cancer, when maybe it feels like a treatment is not going to be effective any longer. Is that the case, or what are you seeing now?
We see some of that. So anytime somebody has an illness that we basically can't fix, which can be cancer or end stage COPD or heart failure, anything that could shorten somebody's life and that it is associated with suffering of any kind, whether it's physical, emotional, spiritual, we help with all of that. Right now, we're seeing a lot of two things. We're seeing a lot of COVID, a lot of people hospitalized, both just in the hospital and also in the ICU from COVID. And we're seeing a lot of cancer and other illnesses that got diagnosed really late because of COVID, because of the lack of either availability of care or people who are avoiding going to the doctor. So that's what we're seeing mostly right now.
So how does a person with COVID get to the point where they are on palliative care?
Good question. Usually it's because they are so sick and not getting better, and we need to decide what kind of care to continue or not continue. When somebody gets really sick with COVID and they need to be on the breathing machine or other forms of life support, we haven't seen very good outcomes with that in general, in terms of survivability or leaving the hospital intact as the person you were before you got sick. And so we get involved to help talk with the family, sometimes the patient if they're able, but mostly the family, about what we're seeing in how sick they are and do they want to keep going? Do they want to, for instance, move the breathing tube from the mouth to a surgical breathing tube in the neck for a person to live in a long-term care facility to see if they get better? Things like that. And so we get involved to facilitate conversations and talk through what we call goals of care with families about, if your loved one isn't going to be able to get off this breathing machine, or because COVID causes things like strokes and heart attacks and blood clots everywhere, they're now maybe, neurologically not the same person they were. Would they want to try to keep going? And those are the conversations we have to decide how best to care for their loved one at this point.
So you're seeing palliative care patients both for the immediate effects of COVID, such as respiratory effects like inability to breathe, maybe needing a trach, but also you're seeing like the secondary effects because COVID increases your coagulability, more likely to have a blood clot. So you're seeing people who have had heart attacks and strokes that then have the side effects of heart attacks and strokes, and maybe in a palliative care situation for that as well. Is that correct?
Yeah, unfortunately, we're seeing a lot of people who have that. Even people who had COVID and actually didn't have the respiratory problems or compromise we're still seeing that after they've recovered or semi-recovered from COVID, they all of a sudden are having all these other problems, like the strokes and the heart attacks. And we're seeing it in a lot of different age groups, and it's sort of all over. I'm pretty surprised at how young some patients are who come in with really bad strokes because of COVID.
What kind of age group are you talking about there?
I have taken care of way more 30 and 40-year-olds than I ever have before in my career in the ICU on multiple forms of life support, all precipitated by their COVID infection.
And are these vaccinated or unvaccinated patients, or a combination?
Right now, we're basically only seeing unvaccinated patients need to be hospitalized or on life support.
Okay. So you're seeing as young as 30, 40-year-olds, side effects of COVID, immediate effects of COVID. And the palliative care gets involved in helping with the decision-making process for those families. Is that correct?
Yeah, and we do it for anybody. You know, it used to be that our patient population tended to be much older. Some certain types of cancers or trauma we would get involved for, but now we're seeing more young people because of COVID related stuff. So we do obviously still have 50 to 80-year-olds, but just as many 30 and 40-year-olds.
Mm-hmm. Okay, thank you for that information, because I think that a lot of people don't realize that young people are being affected and that this can be a super dangerous illness, even for young, healthy people. I mean, I'm sure that some of the patients that you have comorbid conditions, but I imagine some of them do not. And that can be scary for people, you know, to think about that it's not always predictable who's going to get super sick from COVID.
That's actually a really good point. I think we tried to predict who was going to get really sick from this at the beginning. And it's just unbelievable to me. I've had 85-year-olds with COPD survive COVID, and I've had 30-year-olds who are otherwise healthy not survive. And so it's really hard to predict who's going to get sick. And it doesn't always show, right? People might not have respiratory compromise or all the classic symptoms, get sick, and then a period of time later have these side effects. So it is scary. I think that's one of the scariest things about it. And certainly a lot of people, you know, have the comorbidities of being obese or having diabetes or having underlying autoimmune disorders. So those people are at higher risk, but a lot of people don't have those things. And so I do think that's one of the scariest things about it.
So your advice would be to get vaccinated, right?
Please get vaccinated. Yes, absolutely. Everybody needs to be vaccinated to protect you and your loved ones and your community, because we can't predict who it's going to cause these devastating illnesses in.
Thank you very much for your time, Dr. Rankin, and for your wise words. We really appreciate you sharing your stories and experiences with us.
Well, I appreciate being here. Thank you.